Everyone, I would like to invite you to the Table of Grace.
At the table of grace, the cup's never empty, the plate's always full, and it's never too late to come and be filled with love never ending. You're always welcome to the table of grace.
Hi, welcome to Table of Grace. I'm Melissa Hilton. This week we will be speaking to Mr. Andre O'Brien, who's the director of Mercy Clinic here in Green City. As you all know, this is a show with Radio Guadalupe and Blazing to the Bone, where we speak to people whose faith are strong in the Lord and has been touched by God's grace. So please join us when we come back. We will be hearing all that the clinic offers.
At the table of grace, the cup's never empty, the plate's always full, and it's never too late.
The Table of Grace.
At the table of grace, the cup's never empty, the plate's always full, and it's never too late.
Welcome back to Table of Grace. I'm Melissa, and with me today we have Mr. O'Brien. How are you, Mr. O'Brien?
I'm doing pretty good, thank you. I'm glad to be here with you today.
Great. We're talking about Mercy Clinic. It's been around for a while. I don't know much about it. As a matter of fact, I'll be very guilty in saying I don't know about it at all. I've heard about Mercy Clinic and Mercy Kitchen, and yes, they help out, but I don't know a lot. So you're giving us insight on it.
Right.
Will help me and help the entire public, as a matter of fact. Who developed the clinic? Who started it?
First of all, it's all volunteer service. There's no repayment monetarily to board members. It's all volunteer work. And I believe that the longest standing board member, volunteer board member we have and currently have is Mrs. Sandra Bedran from Atlantic Bank. Okay. She's one of our longest standing board members. We have other board members such as, just to name a few, Sister Carolee Chanona, Sister Margaret Salisbury. We have Mrs. Martha Mitchell, who is an associate of the Sisters of Mercy. We have had members such as Rose Moose, Betty Jean Hunt. We have had a lot of people that were able to give a lot of their time, their resources, and really push for a center to progress and stay running and keep the doors open.
Yeah.
We at a management level, we can't do it alone. You know, we need their support. So we work very closely together with each other in terms of keeping the ministry alive. That is very important. You're going to hear me a lot mention keeping the ministry alive. Okay. As I said, it's not only a clinic, it's a feeding program. I mean, we go beyond that. A lot of people come into us, they don't have grandchildren, they don't have children, or they do and they don't have any kind of interaction with them. And they're looking at us as that missing figure in their life. It's just to get a hug, 2 minutes of your time.
So you have events for them?
We do have events.
Okay.
We do have events. And every day coming to the clinic for a patient is an event.
Oh, really?
It's an event. Because we're dealing with a population that is all elderly.
Yeah.
And that is the only place that they can come together and see someone that they have not seen for years.
So basically your doors are open every day, or Monday
We're
to
open
Friday?
Monday through Friday.
Okay.
The clinic starts operation at 7:30 to 4. Why so early?
Do you need to be registered at this clinic? Or?
Yes.
any elder person can just walk in.
We need to have you registered.
Okay.
Why I say registered is because in 2009, in an effort to keep our doors open, we were able to sign a contract with the National Health Insurance, NHI.
Okay.
So we are a registered NHI provider, providing services for the elderly population,
Okay.
60 years and older, within the District of Belize. So we can go far south as Gales Point, Manatee, far north as Crooked Tree,
Okay,
Mascal, North Side, if you're elderly.
I thought it was only within city limits.
But we were able to, you know, the elderly population is a small population, and we want to be able to have our doors open and not be discriminating.
Okay.
No, you're elderly, you're living on the south side. Normally it was that case. You're only on the south. So what happened about the elderly people that lives on the north side?
Yeah.
They're elderly, and the system is set up in such a way that it doesn't matter if you have money or not, or what's your background or not. The criteria are you're 60 years and older, you're registered with Social Security, you have a Social Security card, then we can register you.
Okay, and they go to the clinic.
Then they
for
come.
services. Do you,
It's services under primary care.
okay.
And we have a large number of our patients with diabetes, hypertension, and now we're noticing Alzheimer's on the climb, which is typical for persons in our age group that we deal with.
Do you do house visits?
We do house visit. That's a very unique project.
Okay.
We have a nurse and a doctor that works with us that goes out once a month to the homes, and they get the same exact services as they would receive coming into the clinic.
How many doctors do you have working with you guys?
Currently on staff, we have 2 full-time doctors in-house.
Okay.
Ideally, it's normally a male and a female. You do have patients that would prefer to see females, some males, so we have to cater to them both.
Some don't care.
Exactly. They just want to know that they're getting there, they're going to see a doctor, they're going to get the treatment that they need, and then move on. We also have 2 full-time nurses, a registered nurse, an RN, and a practical nurse, PN. We have our own pharmacy on site.
Oh, wow.
We have a data entry clerk. We have a cleaner, messenger. So we have roughly about maybe 10 persons working with us.
Okay.
And of course, we do have doctors on call on a roster that we tend to use from time to time on a needed basis. Maybe one of our doctors is out on training, vacation, ill, whatever the case may be.
And the doctors, they're volunteers as well?
No, the staff is not volunteers. That's the only thing. The staff is paid. However, they're not paid based on qualifications. They're not paid based matching on other clinics' doctors.
So,
Because what they're doing is not only seeing a patient, they go beyond that. So when a person comes in, you're bringing your 88-year-old grandmother into us, and she moves very slow, and she needs a little coaxing, and sometimes family doesn't have the time, or they're so stressed from dealing with it at home. It's just like, I just want to get you there, quickly see the doctor, and let's get out of there. And you're pulling and pushing. Yeah. So we're like, okay, we'll take care from here, and we give them that hug. We take them that time, not at home, but when they're there, they're like our family. Okay. They're patients, but we consider our patients family.
Stay there, and then
they can stay the day.
Get the chance, they go back for them.
Right. So if you have an appointment, and your mom or grandmother has an appointment with us, and you have to go out, just leave them. We'll make sure that they're cared for. And then when they're done with their doctor visit, we'll give you a call and say, well, your mom's ready. You can come pick her up.
That's cool.
Now, that is where the other aspect comes in. They have the kitchen section, which goes beyond feeding program. They have a waiting area. They play games. They watch television. It's a safe haven for the elderly population.
And they're both at the same location?
The same location.
Okay.
We have a right wing and a left wing.
Another wing. We need a center one.
We're working on that. But to touch more back on the clinic outreach portion, we have roughly about 50 members homebound, and there is a specific criteria set up to that. So that's not open to any and everybody.
Oh, okay.
Criteria 1 is that they must be an invalid with limited mobility, or no mobility at all. Wow. So those are the 3 areas that we look at when we get a patient to come on
that list.
On that list for the home care.
And they have to be registered under
It
NHI.
has to be registered under NHI, yes.
So what if you have someone that probably lived outside of Belize district and don't have anyone to take care of them where they live? Mm-hmm. So they would come and stay with a family in the city. Would they be able to
access the service as long as they have a social security card and the family member can verify that they're living with them.
Okay.
I mean, when it comes to an older person, it's hard for an older person to say, this is my exact physical address.
Yeah.
Because if you have children, many children, and you're sharing your time with your children, you might have one living in Corozal, one living in PG, one living in San Pedro. So you don't have a set base address because your kids are sharing you. So the one that is in Belize City would be the main address holder. Okay. And then we would be able to register that person on that address.
I asked because there's a lot of times when you have the elderly living away from you, because I used to live in Orange Walk and then I moved to city, whatever the case is. And after that, the person in the city would say, okay, you don't have anyone to be with you. You're old and I'm scared for you. So come and live with me. And if by doing that and they're not registered under NHI, I think the clinics give a bit of hard time.
That's normally the case. That's normally the case. If you don't have a Belize City address, you can't register for NHI.
Yeah, that's the thing.
Sadly, that is the way the system is set up. Maybe it's being addressed now, where you have now an NHI rollout in Corozal. Okay. So you have isolated areas now. You have Orange Walk left out, and you have San Ignacio Belmopan area left out. So slowly by slowly, we're seeing a change, and hopefully, that's a government issue and government policy issue that they will be able to.
Nonetheless, and say,
yes.
Okay,
no.
I have 88-year-old, 85-year-old staying with me. I would like some sort of services.
Mm-hmm. We will be able to. Normally, the process is that the person or the address holder would get, I believe it's a minister, a priest.
Yeah.
Or a JP or a commissioner of the Supreme Court to verify that that person is living there. So they would have to show proof that the person is living there. And then they would be able to take that proof of address to Social Security,
to Social Security,
do a change of address for the person, and then we would get the slip coming from Social Security. It's a simple eligibility slip. And then from there, we would be able to register you. People might be looking at the show and say, but I don't register already and I not come yet. Well, there is a waiting list. Like everything else, there is a waiting list. And the waiting list tends to be long. We are at about maybe a month and a half back in appointments.
Oh, wow.
Because every new patient that comes in, it takes a little bit longer than usual. And within 1 month, there is a 2 to 3 time visit before they can get on a regular monthly or 2 months appointment system. So we do operate an appointment system, and we have roughly about 1,400 persons registered.
That gets that monthly.
Monthly.
Wow, it's amazing. We need to take a break, but when we come back, I want to talk more on how you guys are. Because you don't have like a budget per se, so you need to do that
fundraising.
Yes. We'll take a very short commercial break and we'll be back with Table of Grace and Mr. O'Brien in the ways you can assist the clinic. We'll be right back.
At the table of grace, the cup's never empty, the plate's always full, and it's never too late.
The Table of Grace.
At the table of grace, the cup's never empty, the plate's always full, and it's never too late.
Welcome back to Table of Grace. Here with Mr. O'Brien, who's talking on the services that Mercy Clinic offers. Mr. O'Brien, I know I wanted to touch on the fundraising that you guys do. However, a center that offers that type of services must have a mission statement.
Yes, we do. And I'll read you what we have here in the mission statement. As a ministry of the Sisters of Mercy, the Mercy Center exists to serve God, responding to and advocating for the vulnerable, low-income elderly in Belize. And it does this by providing holistic health and human services without discrimination. Faithful to Catherine Macaulay's service legacy, marked by dignity, justice, service, and compassion, the Mercy Center will work in collaborative partnerships to address immediate needs and root causes of injustice and suffering.
By hearing that, what I am thinking of is we tend to have a lot of elderly living alone. They hardly get to see their children, or they probably don't have any, or anybody by their side, any caregiver at all. It's always they live by themselves. If they need to go to the clinic, if they need to pay their bills or do anything, it's always alone. How do you do someone that is registered with you guys, go in on a normal basis, on a monthly basis, whatever it is, for their checkup, and 1 month they don't show up? Do you guys go and visit them, or how do that work?
Yeah, it's funny you ask that because one of the things that we try to do is to encourage members of the community to look out for others, look out for the elderly. You know, you have someone living a couple houses away from you that's an elderly living alone, no family member, no support. Take a couple minutes out of your time. It only takes 5 minutes. Pop in the morning. You know, do you have your breakfast? Have you taken your medication? You know, just checking in on you. You haven't seen them for a couple of days. Whoa, I haven't seen that person. Let me, you know, see what's going on. We need to try and change the mentality of our community. And a lot of people look at these things, and when I say these things, caring for an elderly, it's like, if I'm not going to be paid for it, I'm not going to do it.
Yeah, it's not related to me.
Right. Why bother? Think about you when you get older. Do you have kids? Will your kids be there for you as you're being there for someone? You know? Because a lot of these people, in truth, they probably have kids. They haven't been with their kids. And a lot of people, they raise up and they say, my mom or my dad didn't raise me, so why should I even bother? They didn't care for me. My grandmother raised me. She's dead and gone. Let's forget about the past and give back. A little bit is all they need. Collaborative work that we do is that we work closely with the Ministry of Human Development for a lot of referrals.
Okay.
So they give us referrals for patients that needs attention, and we give them referrals as if we're seeing a patient being neglected or suffering from whatever the case may be, then we refer patients to them. And that's done on both sections. That's done from the clinical standpoint and from the kitchen standpoint.
Can someone who normally walks into the clinic, they're registered with you guys, but they go on their own, can they be switched over to the house visits? And how
it depends on the criteria. That's that is very tricky, because when you're looking at the homebound, we call it homebound outreach program, that's very costly.
Yeah.
The cost on that is very high. Why? Because a cost of vehicle, you're looking at wear and tear, insurance, license, fuel, time. Time is very important.
Time consuming.
It's very time consuming, because a physician can only see 4 patients per morning on an outreach program. Wow. 5 is pushing it.
Wow.
The distances between addresses, traffic congestion, going to the homes, a person is not ready. They need to wait until that person is ready. They have taken their shower, or they're having their breakfast, or maybe they haven't even woken up as yet. So all of that, it takes time. So while a patient walking into the clinic, a doctor would be able to see upwards of 15 per morning, At homebound, we're seeing 4. It's even not even half as what they're seeing. So the productivity for that is very low in outreach. So we have to be very careful how we switch people. Everybody would like to be seen by a doctor in their homes, even myself. But in reality, it doesn't work. So what has to happen is that we take into consideration the distance they live, age,
and their needs.
So if they're living alone and they have no support, no family support, then that person may very well be able to fit that criterion and be switched over. However, there's a proper investigation done, because a lot of persons living on their own, and this is coming from them, not from me. In their investigation, they have families living abroad, they have monies coming in, but what are you doing with your money? You don't have to pay rent. Your bills are being paid for you. With the money that you're getting, you can't afford a taxi or a simple bus ride to the clinic. Why? Oh, I go to the casino, I buy my bolito and lottery. So it's like you're not having your priorities straight.
I would more think they would say, I'm scared.
And remember, what we do costs nothing to a patient. None of our services cost money. Medication is for free. The doctor visits are for free. Absolutely nothing. Just find yourself to the clinic. You're taking a taxi, it's about $6. A bus is $1.
Do you ever get doctors volunteering their time to come in and say, okay, I can do one day and go see maybe 2-3 of your patients, just to give back?
We hardly get doctors like that. There's a small pool of doctors in Belize that we work with. Most doctors are already employed full-time and they're working split shifts or longer shifts with the general hospital. So it's very difficult to work like that. Now, if doctors out there that wants to do that and they're seeing this interview, come in, bring your resume. We treat them as we would be hiring a full-time physician, because we need to make sure that we have dotted all our I's and crossed all our T's, that we have qualified physicians attending to these patients, because you're sending doctors into these people's homes. So we need for them to feel comfortable that, you know, Mercy Clinic is sending somebody and they've done their homework, we've done our legwork, we've vetted that person, and we're comfortable to know that we have a verified doctor safe to go into your home and give you the care you need.
I want to ask something. We have this tendency with a lot of more elderly people taking this mental thinking. I believe in my God. I do not need medications to get me better. My God will take care of me. Even though they know, as well as everybody else know, at some point you need that medication. How do you deal with patients like that?
We see it all the time. We're a Sisters of Mercy Catholic institution, but we see a wide cross-section of religions and religious beliefs. We do not discriminate. We do have patients that come in and say, I just want to get my checkup and I don't need the medication, or they get the medication and don't take it. Why don't you take your medication? Well, you know, my God, and take care of me, I pray. Yes, praying is good. We support that 100%. Yeah. Without God, nothing is possible.
Exactly.
But God also helped to make medications that you need to take to help you.
Yeah.
You know, the Lord also said, help yourself and I shall help you. So taking your medication, the time, and your prayers is a combination that is needed.
Yeah. Do you get, since it's the summer and everything, have you ever gotten a student that walks in and say, I want to volunteer. I don't know anything about medication. I don't know anything about the elderly, but I want to volunteer. Maybe while one is there waiting for their family to come and pick them up, or they just want to get out of the house and they're waiting there a little while, they talk to them. Why I'm asking is because when I was at SCA, we had
you're a mercy girl, okay.
Yeah. We had to do community services, and then I was at I went to the old people home by
Sister Cecilia.
Yeah, Sister Cecilia. And just by being there for that short time, by talking to them, you get to hear them sing, they dance, listen to their past. That alone brought joy to that person. So I was wondering that if maybe you would get volunteers during the summer just to go and do that and brighten up their spirits a little.
We get volunteers so much that sometimes we can't take all of them. We have to turn people away. When you're looking at the medical aspect of it, it's very difficult for us to put a volunteer
to that part
in that area, because patient confidentiality is of utmost importance to us. So it is very difficult for us to put volunteers into the clinic section. We do get them if it's an intern doing business and they're coming from UB or the sixth form or even high school. Okay. Then we put them in there and they have to sign a confidentiality clause. And then they do refiling and filing and sorting out documents and stuff like that. But when you're looking at volunteers, we normally get them to help us clean, sort storerooms out. We find work for them to do.
Okay.
The kitchen section, however, does a lot of what you mentioned. The students, they come in, even non-students, volunteers on a whole come in and help to prepare meals, cleaning up the kitchen, serving the elderly, playing games with them. Okay. We have volunteers coming in to do haircuts. Wow. It was a whole cross-section of it. There was an outlet for everything. But due to funding, we had to cut back a little bit because even though they're volunteering, it still costs us because you have to find refreshments and the whole 9 yards. So we had to really look at it close and say, okay, this is what we're going to do. It's a pity our manager couldn't make it in today, and maybe we can extend another time for her to come in and expand more on what the kitchen services does. But she does take a fair number of volunteers from primary school students to high school students.
Okay.
The only downside to us getting volunteers is that the elderly is so dynamic is that in the afternoons there is no need for a volunteer.
Really?
Most of our population comes in the morning. 6:37, the gates are open.
And they're already there.
You have a number of them coming in because their biological internal clock has changed. They are up earlier.
And
it's cooler for them. And then at the midday, they had their lunch and then they're done for the rest of the day. That's it. Okay. So in the afternoon, we have less patients as opposed to in the morning.
That's the morning. Wow. I just want to clarify one thing before we take a break. If you don't have any NHI and you're not registered there any at all, but they're at home, they're listening to this particular show, and they're like, I want to go to that clinic. Even if it's just a one-time thing, would you welcome them?
We do welcome them. We welcome them with open arms. It's still service. It's still within our mission not to discriminate and to offer the service. So we would take them in. They would see a physician. They would get their medication on a one-time for free. And then within that time, we would encourage them to register for Social Security.
What if they are registered somewhere else and just want to go there? Why I'm asking
that is tricky.
Is because a lot of them would say, where I go, I don't get a hug. The clinic that I go, they don't hug me. Mm-hmm. I don't feel a part of the family there. But at this clinic, man, I could go and get a nice hug and everything.
Right.
When we come back, you answer that, because I know a lot of them will stay tuned to hear if they can go there for that hug. We'll be
free hugs.
Free hugs. We'll be right back with Table of Grace. So you'll be able to know if you're going to get that free hug at Mercy Clinic. We'll be right back.
At the table of grace, the cup's never empty. The plate's always full, and it's never too late.
The table of grace.
At the table of grace, the cup's never empty. The plate's always full, and it's never too late.
Welcome back to Table of Grace. I'm Melissa Hilton. Mr. O'Brien is here with us from Mercy Clinic. Mr. O'Brien, there's a lot of things to talk about, but when we left, we were asking, or I was asking, someone who is registered at a different clinic, by hearing this, might want to say, I want to go to Mercy Clinic. Is that possible? Because I know the NHI system is a bit tricky and a lot of people don't really understand it.
Yes, they can switch. It's called a transfer. They don't need to have a reason why they want to transfer. It's their option to transfer. But know that when you transfer, you can't go back to where you were. You're only allowed one transfer per year.
Okay.
So if let's say this person is registered at Matron Roberts, they then need to go into Social Security and say, okay, I'm registered at Matron Roberts, but I want to transfer and be a patient of Mercy Care. And then NHI and Social Security will facilitate the transfer, and we would get that notice by an email saying, okay, patient name, Social Security number, and bio, whatever the case may be, has been transferred to your clinic.
And how long after that can they go to you?
We then need to give them an appointment.
Okay.
Remember, we operate strictly on an appointment basis.
Even if that person needs a specific medication for the month? Like, for example, well, what I'm asking is, I go in today to transfer, and I need to wait until you guys give me an appointment. However, in between that waiting, I need to get my prescription.
When we take you as a transferred person, we immediately send an email out to the clinic that you just left, and you say, okay, this patient has transferred from you to me. Can you kindly supply me with information or the patient file?
Okay.
And so we do get a medical history, and then we would know exactly what that person is on, when was the last time they got their medication, and then based on that, we give you a return appointment. So if you just got one last week and you did the transfer the same day, then you can very well get your 30-day return within 30 days or on the 30th day
you can
to
still
us.
go back to the clinic you were prior.
No. You already did your transfer. You already got your meds the same day you did your transfer, which means your medication will expire or has finished within 30 days. So at the end of that would be the same day we would give you your appointment to us. Yes.
Okay.
So it's not going to interrupt your medication flow at all. It's going to continue.
They would be wondering as well.
Yes.
And your funding, your fundraising, how do you guys support yourselves?
Okay. The NHI program is an NHI funded program. So that's funded through the government of Belize. So the bulk of the funding comes in from that for the clinic, and that's what we operate on. Anything outside of that, then we have to look at closely and say, okay, who do we contact? Where do we go from here?
Okay.
I know that my colleague, the kitchen manager, has been doing fundraising off and on for her projects, but we operate different budgets.
Okay.
So what she raises on her own is for her projects. The clinic has not been doing much fundraising or any at all. But as time goes by, and we're now identifying new projects that we need to start embarking on. Okay. So we would shortly, whenever those start rolling out, looking at ways of funding that and keeping it going.
So anybody can walk in and say, I want to do some sort of donation.
Yes.
Either to the clinic or to
you
the
can
kitchen.
specify as a donor, say, okay, I have $1,000 that I want to give this center, and it needs to be shared equally between both ministries.
Left wing and right wing.
Yes. And then that is done. We accept donations not only in cash, but in kind. We tend not to reject anything at all.
Okay.
We get a lot of clothes coming in, which we always need. And we don't say, well, okay, we're only elderly, so we only want adult clothing. No, we do work with other agencies. We sort these clothes out, and then we distribute them to the agency that we feel can use it best.
Oh, wow, I didn't know that. I didn't know you guys give clothing as well. I thought it was just that medical aspect.
Well, when you're looking at the kitchen section, from the holistic standpoint of it, we all pride ourselves on this. Our facility is one of the cleanest facility. So we were told. So we try and keep what we're doing going. Before a person goes into the dining room for a breakfast or a lunch, breakfast most importantly, is that they need to take a shower. They need to be clean because you're sitting around other people, you know. We do have people that are homeless that comes into us for meals. Okay. So they're allowed to take a shower. They drop their clothes. If it's soiled beyond, yes, it's then tagged like our garbage. The clinic has garbage removal protocols and different colors for different items. So then items like that would go in a red bag tagged and would be burnt. Okay. To prevent people from sifting through the garbage and they find, I found a shirt and I wash it and use it. So we would give them a change of clothes. So you take a shower, you drop your clothes. If it can be washed, it's washed and it's folded back for you for tomorrow. So that's how we operate that. So we have laundry facility, feeding facility, medical services, chapel services, games, haircuts.
You have a
There's a whole, there? We do have a chapel there, yes.
They can use it as well.
We have chapel services every Tuesday.
Okay.
Every Tuesday morning. I believe that we do get a break from the volunteers from that program during the summer. I can't remember the exact dates.
Is the chapel open to those visiting the clinic?
It's only, we only have it open on Tuesdays for services.
Okay.
Other than that, we keep it closed. Why? Is because we do have, we've had instances whereby things were stolen from inside of it. So we need to protect it and the items in there. Yeah. So it's only accessible on chapel days.
If there's anything that you would like to tell the general public on Mercy Clinic, what is there that you would like them to know?
There's a lot that we want to tell the public. We want to tell the public that the clinic is one of the best clinics for families and patients. And this has been verified by our audits. We're audited twice per year.
Okay. By government?
By the NHI and Ministry of Health. Okay. They have a team, and all the NHI clinics are audited.
Let me ask you something. Do they audit you guys? Well, the other
it's not a financial audit.
A financial
It's not a financial audit. Okay, when we say an audit, we have, at the beginning of the year, we all sit down together and then they have KPIs, which are key performance indicators that each clinic must meet within the year. And based on that, then they come in and audit. 5 items are on your KPIs. How far or how well are you doing or not well are you doing on your KPIs? Okay. And then that basically tells us, management from the clinic, where do we stand? Are we heading down the right road or we've veered off? We need to pull it back in line. We need to ensure that we're following protocol and implementing X, Y, and Z. One of the biggest things that we have been holding on to for the past 3 years, I believe, is being the #1 clinic for patient satisfaction. So we're on top of all the other clinics. People might say, but get audited different. No. We're the youngest clinic to have opened amongst the senior clinics. Okay. But we're all measured on the same level. Yeah. It just so happens our population is a different group. Yeah. So we're #1 clinic. We want to encourage people to come and register. We want to encourage people to bring family members in, keep up with their appointments, keep up with their medication. A lot of people might get after me for saying this, but broad shoulders, I can take it. We need to promote healthy life in our elderly and cherish our elderly persons. You know, a lot of us want to look at older people, they're old, it's just best that they die. No, these older persons has paved the way for us, the younger ones, and we need to give back.
Yeah.
as much as we can.
Definitely.
In terms of donations, it doesn't have to be large sums of money. It can be $5, it can be $1. Every penny counts. Every penny goes a long way, and you know that your donations are going to a worthy cause, and nothing is being wasted.
Do you have any major plans for the coming year?
We are working, one of the plans that we have been working on from last year, and we are hoping that by the end of this year we can close off on it and actually start the program running next year, is to open in-house physiotherapy area.
Yeah.
And the plan is to have that and have a full-time employed physiotherapist to help with people, to help with older persons, fall prevention, joint care, stroke victims, stuff like that.
I have a lot of that in where they've suffered strokes, and that's it right there at home. They don't have anyone to do that.
There is no follow-up. And that is when a patient or person starts deteriorating.
Yeah.
They give up. There is no shove. There is nobody to cheer them on and say, okay, let's do this. You can do it. That is what older persons need. We must always remember also that older persons are very proud persons. They're not going to reach out.
Help.
Exactly. They're not going to reach out and say, you know what, I need help.
Yeah.
But if you don't overpower them, but push yourself a little bit and say, let me help you, they're going to accept it. But they would never be the first to say, I am hungry and I need help.
Yeah, it's true.
Those are the ones that shy away, and those are the ones that we need. We need people like that to come out and say, listen, in this area we have these people living there, they really desperately need it. And then we send somebody out to go out and do an evaluation and follow through on our protocols. We work on a lot of protocols and manuals as to how we do these things. How do we capture persons? How do we capture families that needs help? You know, we have a lot of older persons that are taking care of grandkids that really needs help. So can we help them with money financially? No. Because we ourselves need the money. But we can help them, and we can find help for them, even if it's just to help that older person, that older person, he or she may be able to provide a little bit more for their family members.
Yeah.
You do have older persons that are still working because, you know, that's what they're already used to. That's what they know about. They want to continue earning for themselves. So we encourage things like that.
I enjoyed this. It was very informative to me. Still having my grandmother with me. Something that I think a lot of us need to know is that the elders are there not just to guide us in our day-to-day lives. They're if we listen to their experiences and their advice, we would be much happier and get ourselves into a lot less of troubles. Personally, I have been blessed by having both my grandparents. My grandfather died 2 years ago. He was 97. And what I learned from them are some amazing values that will take me through my life. My grandmother is still alive. She's 88 years old. If we as a public would just take the time out, they probably don't have to be your relative, as Mr. O'Brien mentioned, but they're in our community. Talk to them. A lot of the things that we're facing can definitely be changed by hearing one conversation. If you know of 1, 2, it doesn't matter, any amount of elderly out there, go to the Mercy Clinic, inform them. I know of this person, she probably needs help. Do it. Go and say hi. Talk to her. Ask her how she's feeling, how he's feeling, if they need anything. Take 5 minutes out of your time and listen to a story that they has to say. You would be amazed by how that particular story can touch you and can change your life. We as young people say, oh, I don't need them, we don't need them, but we do. We do. We need the elders. And they, as much as they want to deny it, they need us. By having us around, it extends their lifespan. And by having them, their lifespan being expanded, ours will too. I'm Melissa Hilton for Table of Grace. It was my honor to have Mr. O'Brien with me today. I learned a lot, and I hope you do too. And as I always say, when you wake in the morning, thank the Lord for your life, your family, your friends, your country. And this week, please extend a hand out to an elder or two. When you see them crossing the street, stop. Let me assist you. They might refuse it at first, but that will make their day. They will have a smile on their face for the rest of that week. See you next time on Table of Grace.
At the table of grace, the cup's never empty, the plate's always full, and it's never too late to come and be filled with a love never ending. You're always welcome to the table of grace.